Next presentation, Homerosky from Canada. And exactly from where?
What's that?
From? Canada?
From
Canada is big.
University of Calgary.
From Calgary. Okay, thank you. Yep. You can also introduce your presentation by yourself. Thank you.
Thank you for the introduction. Thank you also to the organizing committee for selecting this abstract. I'm not sure if they gave preference to redheads, but I'm thankful just the same. So today I'll be sharing with you some clinical indicators that you or your producers can use to identify calves with acidemia in the absence of a blood gas analyzer. There we go. So transition from intrauterine to extrauterine life is physiologically complex, and it's coupled with high risk. In North America, it's estimated that 62% of the pre-weaning mortality of beef calves occurs either during the birthing process or in that first 24 hours. Prompt identification of calves with acidemia is particularly beneficial, especially those with severe decreases below 7.2. That's a cutoff that we would generally consider to be normal in a newborn calf. With severe decreases below 7.2, we start to see increased risk for mortality. And even though that might comprise a small proportion of the overall population, among the surviving calves, we're likely going to have reduced efficiency of absorption of immunoglobulins from the colostrum, and we're also going to have increased risk of morbidity. And so for a number of years, the cattle industry has tried to adapt APGAR scores that are widely used in human medicine for calves. These are 10-point indexes based on 5 parameters. This would be the resulting scoring system that is most commonly reported in the literature or used in different research studies. They include heart rate, respiratory rate, mucous membrane color, and then a multitude of tests to either gauge reflexes or muscle tonicity. Unfortunately, these have never been widely adopted. It's for a couple different reasons. Some authors propose that they're inherently complex, and also they do not consistently identify calves with blood gas disturbances. And part of that is probably because of the methods that were used to design this APGAR score. So equal weight is given to each score, each category within a parameter, and equal weights given to each parameter within the overall index. The parameters were merely adopted from human medicine, and they were never individually evaluated for their association with an outcome of interest before they were included in this index. And so that might cause some weighting issues. And so that brings us to the objective for this study, which was to critically evaluate those 5 parameters that are commonly used in the APGAR score on an individual basis for their association with acidemia. The producer also has a lot of other data that is already available to him at Calving or that he could easily collect that also may be associated with acidemia. And so the second objective was to explore some of those options. This study was conducted on a large commercial operation in southern Alberta. They run approximately 800 head of Hereford-based cattle. During the month of March, I enrolled every pulled calf that I feasibly could. And so approximately half of the calves that were enrolled overall were easy assist or manual pulls. About 20% were difficult assist or mechanical pulls. And then for every 2 to 3 pulls, I then also enrolled a calf that was born unassisted in the pasture for a total sample size of 77 calves. At 10 minutes after birth, I collected calving characteristics and clinical examination parameters, things that a producer could easily collect. These included things like birth weight, parity, ambient temperature, heart rate, mucous membrane color. Was there Was there meconium staining present? Was the tongue swollen and protruding? And also a number of tests to gauge muscle tonicity and reflexes. I also collected a venous blood sample, and from that performed a blood gas analysis. The majority of the variables in my data set did not follow normal distribution, and so I had both non-parametric and parametric tests. I also used a backward stepwise multivariable linear regression to determine what variables were significantly associated with acidemia. And so moving into the results, if you recall, the first two parameters that are commonly included in the APGAR score are heart rate and respiratory rate. And as you can see here, when I plot those against pH, there's no apparent association. The next most common parameter that are included in the modified APGAR scores for calves is mucous membrane color. And so while calves with a normal mucous membrane color, pink, had numerically a higher pH as compared to calves with the abnormal result, red, white, or blue mucous membranes, the p-value was only 0.07. Moving on to the test for muscle tonicity and reflexes, I want to specifically talk a little bit more about suckle reflex and tongue withdrawal. Suckle reflex was determined by placing 2 fingers longitudinally in the calf's mouth and categorizing that suckle reflex as weak versus strong. And so calves with a weak suckle reflex were more acidemic as compared to calves with a strong suckle reflex, which we considered the normal result. Tongue withdrawal was determined by pinching the rostral portion of that calf's tongue and determining if that calf had enough muscle tonicity to fully retract that tongue into the oral cavity or not. And so calves with a complete withdrawal, a normal result, had a higher pH as compared to calves with an incomplete withdrawal. Both of those parameters were significantly associated with pH. And so in summary, when we again evaluate those 5 parameters in the APGAR score, heart rate and respiratory rate are not associated with pH. Mucous membrane color is questionable, trends towards significance, but inclusion of parameters that measure either strength of reflexes or muscle tonicity are excellent indicators of pH. As I mentioned earlier, there's a lot of other calving characteristics, clinical examination parameters that your producers could easily collect with minimal tools, and so I wanted to explore those as well. I used a linear regression here to determine the factors that are most significantly associated with acidemia. And so the first one was tongue withdrawal, which we've already discussed. Additionally, parity was associated with pH. And so a calf that was born to a heifer was more likely to be acidemic as compared to a calf that was born to a mature cow. Calving ease was also included in the final model, and the difference here was primarily driven by that low pH that was reported in the difficult assist or the mechanical pulse. So just to review some key discussion points, indicators of muscle tonicity and strength of reflexes are associated with pH. This has also been reported by numerous other authors. And it's also, as we heard earlier, can be an indicator for neonatal calf, the acidosis associated with neonatal calf diarrhea. Remaining APGAR parameters, primarily heart rate, respiratory rate, potentially mucous membrane color, are questionable in terms of their ability to identify an acidemic calf. However, utilizing measures of calving ease and parity may be useful for your producers to help identify an acidemic calf in a prompt manner. With that, I would like to acknowledge the folks at the University of Calgary, my supervisors, Drs. Windier and Kostelic, committee members, Drs. Timsit and Pager. Also, thank you to Drs. Kwong, Kalkett, and Boyson for their assistance with this study, the research crew, and of course the calving crew. It made calving season much more stressful on them than it already was. And also, thank you to the Simpson Ranch Fellowship Beef Cattle Health Endowment for funding this research.
Thank you very much. We have now time for some questions. Yes, there.
Hi, Walter Grünberg from Hannover. Great presentation, I like that. I was wondering, did you have a chance to look at the association with the different types of acidemia? Because right now you're assuming acidemia per se is the issue. My clinical experience is that respiratory acidosis has a much greater impact than metabolic acidosis. So it might have been worthwhile to differentiate that. Did you have a chance to look into this?
Yeah, so I didn't kind of abbreviated some of the results in my thesis just for the sake of time. And so I did look individually at all those blood gases and consulted with an anesthesiologist as well. And so the majority of the calves in my data set would have had a mixed respiratory and metabolic acidosis. That's quite consistent with what you'll find in the literature as well. Some of the most interesting results that came out of this study were the associations with lactate. And I think calves, I also collected blood gas analysis at 24 hours. And so the calves that weren't able to correct their pH, the primary driver there appears to be lactate. And I ran some different models with that as well. And so I think what we're dealing with is an intrauterine hypoxia, poor perfusion, increased lactate, and then we're seeing these prolonged acidemia in these calves.
Loyal Zurich. I have a little comment on the APGAR scoring because we use it for years and we don't use the respiration or the breathing rate, but we look on if the breathing and the heart rate is regular, it's normal, or is there some changes in the respiration and the heart rate, or is there no respiration and heart rate? And I think this is more correlated than the respiration rate and the heart rate itself.
Yeah, that's an excellent point that you bring up. There are dozens of variations of this score. And I guess the big picture, I totally agree with you that rhythm is probably more important than rate in these newborn calves. My big picture question to you is, if we're going to ask our producers to perform some type of clinical-based assessment on newborn calves, is acidemia the most practical thing for us to assess? Or is there something that might have a greater impact on morbidity in the bottom line of our producers? And so my next presentation at 11:30, I'll be addressing that. And in that, I'm proposing an entirely different type of scoring system for calves that I think is I hope much more practical for producers and will eventually positively impact their bottom lines. So.
Okay, then thank you.
Thank you.
Elizabeth.